All right, thanks everybody. You've made it to the last talk of the evening. Stephen Leckie, I'll be talking about orthopedic injuries in combat sports. And this is something that I've taken an interest in ever since I was about 13 when I got started in this. I've been doing orthopedic surgery here for about 11 years, but I've been involved in some kind of martial arts ever since I was, before I was a teenager, and able to continue it in some form or another on and off over the years ever since. And in the last couple of years, I've had the opportunity to teach some of our advanced karate students a little bit about orthopedics. And there's a lot of overlap between orthopedic surgery, trauma surgery, and martial arts, as you can imagine. And so I did this lecture series on orthopedics for martial artists. And then I realized it would be very useful to do some type of a lecture about martial arts for orthopedic surgeons or for medical providers. Because these sports are becoming more and more prevalent and more popular. And most orthopedic surgeons are washed up athletes of one form or another. A lot of them are hockey players or football players. Mine was karate. And we're taking more and more athletes, particularly teenagers, people in their 20s who are involved in these sports. And it's really useful to kind of understand the similarities and differences between this contact sport and other contact sports. My system is a system of karate called Kenpo. I was fortunate to have a school in Newton where I kind of grew up and spent all my formative years. And my most important instructors who are here with us today, first I have to recognize my dad. He's on his, I think, 4th or 5th orthopedic surgery in the last couple of years, possibly related to this. But my dad put in thousands of hours of sweat equity into training me and teaching me how to do this. Joe Esposito, Kathy Esposito, this is their school that I kind of grew up in, and Joe's been an incredible, gifted, and very dedicated teacher, so thank you. When I was in college, I had the opportunity to try a couple of other things for a couple of years. I did some taekwondo and I did kendo, but my main martial art all along has been a system called Kenpo. And these are my sparring partners, and it's become a family tradition too. So this is something that my mom and my dad and my stepmom have done. Now it's something that I'm able to do with my 3 kids. So the question that I have for you, and hopefully we can answer at the end of this talk, is this something that you would want your kids to do? Obviously, I wanted my kids to do it. My dad let his kid do it as well. But there are some risks, there are some consequences. And so compared to other contact sports, is this something you'd want your kids to do? So in this talk, we'll be talking about the different types of combat sports, and it's useful to understand the differences between, for example, boxing and wrestling and karate, and the differences in the rules and the protective equipment, because that's really where the different injury patterns come from. An important distinction will be which of these contests are won by points, which are won by submission, and which are won by a knockout, because the higher impact obviously brings more significant injuries. We'll look at a couple of different mechanisms of injury, so the way that people can be injured when they're participating in these sports, from a throw or takedown, from joint manipulation, from striking, meaning delivering a punch or a kick, and then from what could actually happen to your hands and feet as you are delivering that strike. And then, of course, there's concussions and traumatic brain injury. And we'll be comparing injury patterns in different types of combat sports. So first, the grappling sports. I wanted to start with wrestling. Wrestling's been around for a really long time, in some form or another, thousands of years. Wrestling is an Olympic sport. Greco-Roman and freestyle wrestling are in the Olympics. There's also collegiate wrestling, and the way you win at wrestling is by pinning. So there can be some very significant throws and takedowns, but ultimately that contest is won by pinning the opponent. Sumo wrestling, the national sport of Japan, also very, very old. And in this contest, you win points by forcing the opponent out of the ring, pushing them out of the ring, or by taking them down. Jiu-jitsu. Jiu-jitsu came from feudal Japan. It was an answer to combating armored samurai who had swords. So in jiu-jitsu, there's joint manipulation, chokes, those types of things, because kicking and punching against someone who has armor when you don't is not necessarily the most effective strategy. So from jiu-jitsu, we have judo. That's a more recent addition. That came about in the 1880s. It was adopted by the Tokyo Metropolitan Police. And this is a form of grappling where there are takedowns and throws. A lot of it is using, for example, the lapels, or sometimes it's called jacket wrestling because we're using the lapels as a takedown. Aikido, another form of grappling, also came from jiu-jitsu. And in that, we use the opponent's energy or momentum against them, trying to redirect forces. So another category of combat sports, striking sports. Boxing is very familiar to everyone, and in bare-knuckle boxing had been around for a long time, but in 1867, the Marquis of Queensberry rules made boxing recognizable to us today. So that means gloves, 3-minute rounds, a knockout, which is down for a 10 count. And so here we have Muhammad Ali, famous picture when he knocked out Sonny Liston. What we consider sort of the traditional Asian martial arts. So Kung Fu, originally from China. It spread with Buddhism out of India, Shaolin Temple, and then it became very popular as it entered pop culture with movies like with Bruce Lee. Different forms of karate. When we say karate, that's really kind of an umbrella term. There are different types of karate, like my system, which is called Kenpo, but typically what we're referring to is something that came from Japan, or maybe more specifically Okinawa, which is an island just to the southeast of Japan. These were systems that were developed over long periods of time, and then when American GIs came from the middle of the last century, came back home, they brought karate with them. So this is Ed Parker, who's the grandfather of Kenpo karate, with his most famous student, maybe not his most talented student, but his most famous student, Elvis Presley. And then, Taekwondo from Korea, significant emphasis on kicking. And then there are the martial arts that come from Southeast Asia. And so the one that's most commonly known, Muay Thai, but there are a number of others. And these have different rules. So these are striking sports, but for example, in Muay Thai and the Southeast Asian sports, there is an element of clinching, which means sort of grappling while standing up, meaning you're allowed to manipulate the opponent's arm or hand and use that to pull them into forearms or knees. And those types of strikes might not be permitted in typical competition for other sports. And now we have what we would consider sort of hybrid for combat sports, which involves combination of both striking and grappling. About 100 years ago, jiu-jitsu was exported from Japan to Brazil, and the Gracie family, very prominent family that developed that over this period of time. So Brazilian jiu-jitsu, another sparring system. And from there, they had this tournament where they originally, I think that the intent was to try to figure out which fighters were best. So which backgrounds, which, was it the boxers, was it the kickboxers, was it the karate guys, who had the best fighting system? And from there, they developed this tournament that was called Vale Tudo, or no holds barred, which means you're basically allowed to do whatever you wanted. And from that came UFC, Ultimate Fighting Championship, and then ultimately what we have now, what we call mixed martial arts. And in mixed martial arts and similar systems, there is striking, there is grappling. When you watch it, it looks kind of like there aren't that many rules. There are actually quite a few rules. So it's not that it's lawless. There are things that you're not allowed to do. But it kind of looks like what might be the closest approximation to the real thing or a real fight. And we often get asked, if you've been doing this for a while, like, well, which one's best? Which is, if you want to become a fighter, which is the best one to study? And that's not an easy question, because the reality is all of these systems have something to add or contribute. And what you'll notice is that if you look at students who are like intermediate karate students, they look very different, like so a kung fu student or a karate student, they look very different from each other. But when those students become more and more advanced, they start to look more and more similar. It's like there's this convergence where people are sort of almost like adopting best practice from other systems. And so even though I'm in a system that was traditionally Kenpo, we do a lot of the other stuff. We do a lot of grappling. We've sort of adopted all of those things from other systems. And so in our black belt classes, it might not be a Kenpo class, although it really is a Kenpo class. We're studying other things all at the same time. So there can be significant differences between systems, but the advanced students may in some ways be more similar than different. And if you look at a particular school, students within that same school who have been ostensibly studying the exact same thing can look completely different from one another. So I should clarify, what we're really talking about right now is combat sports, and that is not the same as a real fight. So in a real fight, there are no rules. And what that might mean is that there could be weapons, that there is no protective equipment like gloves and mouth guards. So the injuries that we'll be talking about, those are really come from combat sports, not from fighting. And although they look similar, there is a difference. The combat sports that are full contact are boxing, Muay Thai, and mixed martial arts. And so the level of impact and then the level of injury can be more significant from those. I should also point out, as we talked about before, there's a difference between which ones you win by points, which ones you win by knockout. But a lot of us who are studying martial arts, we're not really studying martial arts for the purpose of competing in tournaments. That's something that, is a spectator sport that you can watch, like you can get pay-per-view and watch mixed martial arts. But most karate students are not doing it for that. They're doing it for other very personal reasons, whether it is self-defense or fitness or any of those other reasons that are important to study these things. Remember that karate and jiu-jitsu historically, that was defense against armored samurai, not point competition. The training for this, it's sort of useful to know like what we do to practice. Every karate school is a little bit different, but usually there's some element of fitness and cross-training. There's some element of practicing basics, whether it's kicks or punches against, in the air in a punching bag. There might be some forms, which are called kata, which are combinations or patterns of techniques. And some of those, particularly in competition, can be very acrobatic. And all of these systems have some, what we consider lethal techniques, or techniques that are too dangerous to be executed during competition. So even mixed martial arts would not allow certain techniques. So different types of mechanisms of injury. First, a throw or a takedown. The first thing we teach all of our white belts is how to fall. And what that means is, as you are being taken down, how do you distribute those forces or tuck and roll so that you don't hit the ground too hard? But even with very significant training and a lot of experience with takedowns, the forces that are imparted to the body during a takedown can be very significant. And so in this study, it measured the forces of impact when someone was taken from standing as a takedown or a throw in 4 different types of takedowns that are very common. And the forces that were imparted to those bodies were very significant. These were comparable to the forces that are experienced when someone's in a low-energy car accident. So if anyone's ever been in a car accident at 10 or 20 miles per hour, you can really get rattled from that. And these takedowns, when you hit the ground, those forces can be basically equivalent. And although we teach people how to fall safely, even very experienced practitioners can still be injured during that takedown. So this is a study from judo, from Japan. These are all experienced participants. And they identified at least a few very serious, very devastating cervical spine injuries, either fracture dislocation, partial or complete paralysis from a takedown. And these are people who are very experienced in falls. So even though the vast majority of the time those falls and takedowns can be done safely, on rare occasion there can be an accident, a freak accident that could be very serious. Another mechanism of injury is joint manipulation. So this is going to be your joint locks. And different joints can dislocate in different ways. So when we talk about joint manipulation, if you take a joint to sort of the extreme of tolerance, like how far can that joint go before it really starts to hurt? If you take that joint to that place, then you can achieve submission. You can stop someone's forward momentum and sort of control that situation. If you take them past that point of submission, take the joint beyond that point of tolerance. If the body is able to follow it, then it's a takedown. If the body is not able to follow, then it's a dislocation. So shoulders typically dislocate anteriorly. The elbow joint can dislocate in hyperextension. The wrist, not as common to dislocate, but you can certainly get submission by hyperflexion, ankle in hyperplantar flexion, all taking those joints to sort of the extreme of what that joint capsule and the tendons around it can tolerate. In competition, finger dislocations or finger manipulation is not allowed, but certainly within like what we would consider small circle jiu-jitsu or manipulating hands and fingers, you can achieve submission, even takedowns, just by manipulating the hand and fingers. We don't typically see as many manipulations at the hip or knee, and the reason is the strongest muscles in your body, which are your core muscles, basically between your chest and your pelvis, you're using those to achieve biomechanical advantage, and the hip and knee, the muscles around those joints are just a little bit too strong for you to be able to overpower in that way, so a lot of our manipulations are really going to be more at the shoulder and then the smaller joints. Another mechanism of injury is what happens during striking or impact force. And so this is a study that looked at different types of commonly performed kicks. So this is called a roundhouse kick. Another type of kick is called a side blade kick. And then kicks that are directed either more to the front or the back. And when you study the forces that can be impacted in, the forces that can be caused in those kicks, the forces can be quite significant, and if you compare those forces to the forces that are required to cause a fracture, so these are the tolerance ranges for common bone, so the radius and ulna in the forearm, the rib cage, the tibia or the femur, and you'll see that the amount of force that's required to cause a fracture is well below the amount of force that can be generated by most of these kicks. So in orthopedics, you really can't state the obvious as true until we have a study to prove it, but what we're saying here is that these strikes can cause fractures. Now, there are some injuries that can occur to the person who is delivering the kick or the punch. So striking injuries, we'll start with the hand and then we'll look at the lower extremity. So a boxer's fracture. Boxer's fractures are kind of poorly named. A properly executed punch is really with the second and third MCP joints. Boxer's fractures are classically the fifth metacarpal, and that comes from possibly a combination of things. One of it might be poor technique, like haymaker punches. Well, part of it is because that fifth metacarpal is kind of unprotected because it's on the ulnar side, it's not in the middle of the hand. But really, boxers, typically they wear gloves, their hands are wrapped, so the reality is we don't really see boxers getting boxers fractures. What we do see is 20-year-old guys who come to the emergency room the next day and they say they punched a wall, and we know they're lying to us, but that's the story we agreed to. There are injuries that can occur to the outstretched hand. So the mechanism of injury for a distal radius fracture or a scaphoid fracture or a perilunate dislocation, that fall on an outstretched hand, which causes wrist fracture, that is the same hand position that we do with a lot of our open hand strikes. So for example, this is called a palm heel. There are injuries that can occur to the abducted thumb. So a gamekeeper's thumb, which is an injury to the ulnar collateral ligament in the hand, that injury occurs from essentially hyperabduction or taking the thumb away from the rest of the fingers and injuring that ligament. Historically, it was named that because gamekeepers were killing fowl by like strangling them with their thumb. Now it's more common with skiers. We call it a skier's thumb because the ski pole takes their thumb. But this is also the same hand position that we use for some of our open-handed strikes. So this is called a tiger's mouth strike. And this can be a strike to the throat, or sometimes we use it as a takedown. So ulnar collateral ligament injury or gamekeeper's thumb. And then this is the hypothenar hammer syndrome. So striking with the ulnar side of the hand, whether it's more of a hammer strike or what we call a sword hand or shuto, you can cause a fracture, of course, but also this injury, which was named for and described for like repetitive hammering, you can get an aneurysm of the ulnar artery in the hand. So hypothenar hammer syndrome, very rare, an aneurysm of that small artery in the hand. Injuries can occur to the fingers. So injuries with the fingers extended, like a pistol finger or poke, that's the same mechanism of injury as you would expect, for example, a mallet finger, which is an injury to the extensor mechanism on the finger. And then what we call a jersey finger. Jersey fingers were originally named for, it was rugby players, and when they were grappling or in close quarters, they were holding on to each other's jerseys, and that would cause an injury to the flexor tendon in their finger. So jersey finger, named from other sports, but we're using those lapels to do a lot of our throws and takedowns, and so you get a jersey finger from that closed hand position. And then there's injuries to the feet. So you can have fractures to the foot depending on which kicking surface you're using. The Lisfranc fracture, dislocation of the midfoot, where you separate the first and second metatarsals, either with a fracture or with a ligamentous injury. That's the same foot position as our front ball kick. You can injure the calcaneus by striking hard against it. And you can injure the outside edge of the foot with our side blade kick, the Jones fracture, which heals poorly. The majority of kicking injuries, although they can happen to the foot that's delivering the strike, the majority of kicking injuries are actually to the leg that is on the ground because of all of the pivoting and spinning. So the wheel kicks, the roundhouse kicks where you're spinning, it's the support leg where you might get that ACL injury that could cause or if you're jumping, it's not the foot you're kicking with, it's the foot you're landing with that could subsequently be injured. So I wanted to compare the injury rates in different types of combat sports, and the Olympics are a useful place to do that because they've been contested for a really long time and the record keeping is really good. The modern Olympics have been around for over 125 years. Wrestling and boxing were there from the beginning. Judo was introduced in the 60s, Taekwondo 25 years ago, and karate appeared as a demo sport briefly in 2020. But the original Olympics, the ancient Olympics in Greece from 776 to BC to 393 AD, so for over 1,000 years, they had their own mixed martial arts, and it was called pankration. So this is a famous statue. You can see it in the Uffizi Museum in Florence, but this is Greek pankration, which would look very similar to mixed martial arts to us. And the early Christians banned the original Olympics because they thought it was associated with pagan gods. That's why it ended in 393. So knowing what you know from the beginning of this talk about the different types of injury patterns that can happen, it can become predictable which injuries you would expect from the different types of martial arts that we're going to present. So the injury rates per 100 athletes, judo and boxing fairly similar, taekwondo and wrestling a little bit less. But if we look at the injury profiles, it should come as no surprise. So injuries to the head and neck, again, this is in the Olympics. Boxing was the highest by far because a lot of those strikes are going to the head, and taekwondo was by far the lowest. And in Olympic taekwondo, there's no punching to the head. Injuries to the upper limb, judo was the highest because of all of the grappling, takedowns, and throws. Injuries to the lower limb, not surprising, taekwondo because of the emphasis on kicking. And then joint sprains, again, with joint manipulation, takedown from highest in judo. And lacerations and abrasions, particularly around the face from glancing blows in boxing. So I wanted to talk a little bit about concussion, and we'll end on concussion because this is really a hot topic, and it's something that we as orthopedic surgeons really adopted from the neurologists and neurosurgeons because we take care of all of the athletes. So the concussion rate is probably all over the map. It's probably underreported, but in sanctioned events for boxing, the concussion rate is probably somewhere in the range of 20 to 30%, although you will find data saying that it's either much higher or much lower. In mixed martial arts, also in sanctioned events, fairly similar at 20%. And in, of course, boxing, mixed martial arts are full contact as compared to karate taekwondo, which is point sparring, which is lighter contact. The rate of concussion is a lot lower, less than 3%. But compare this to football. So in D1 football, the concussion rate is somewhere in the range of 2 per 1,000 plays. So even in the lower contact martial arts, still a higher concussion rate. And the reason for this, of course, if you're in other contact sports like football and hockey, the intent is to move that football or move that hockey puck around. But the intent in combat sports or even in competition is striking, and so the injury rates could be higher. I should point out that a knockout and a concussion are not the same thing, although they can certainly overlap. So a knockout really refers to the inability for that fighter to continue. So what we have now after the 1867 Marquis of Queensberry rules, if someone's down for a 10 count, meaning they are 2 days that they can't get up and continue, then that's a knockout. But that doesn't necessarily mean that they had a traumatic brain injury and they've had a concussion. It could also happen because they're exhausted. It could happen because they're in pain from something else or because they're just disoriented. A technical knockout is something that the referee decides. So if the referee sees that a fighter can't safely continue defending themselves, then they might call that fight and say technical knockout because it would be too dangerous to continue. There are also rules that if you've been knocked down, like in boxing, if you've been down 3 times, then the fight is over as a technical knockout, too dangerous to continue, or if that fighter looks like they can't defend themselves anymore. So even though the concussion rates in mixed martial arts and boxing appear to be similar, I think there are some important differences to appreciate. And I want to make this point partially because boxing's been around for a really long time and it's kind of accepted. And it is a violent sport and it is dangerous. Mixed martial arts kind of came on the scene more like 25 years ago, and at first it was really not accepted because it looks like a blood sport. It looks very barbaric, and with kicking and punching and on the ground and grappling and all that. So isn't it more dangerous? And the answer is possibly not, because remember in mixed martial arts, you can win by another means aside from a knockout. So in mixed martial arts, there might be stand-up kicking and punching, but quite often those fights go to the ground, and then that competition is won by submission, by joint manipulation, as opposed to striking the head. As opposed to boxing, where in a single boxing match there could be multiple head strikes, and those head strikes didn't end the fight, but that cumulative injury to the brain is probably significant. And so in boxing, granted, boxing's been around for a much longer time, but in sanctioned boxing events, there have been greater than 1,000 deaths related to traumatic brain injury over the 150 years that we've been following this. Mixed martial arts only been around for maybe 25, 30 years, but in sanctioned mixed martial arts events, there have been 7 deaths, and now 7 is, of course, too many. But if you compare, in boxing, there were 4 deaths in the last year from traumatic brain injury, then maybe mixed martial arts is really not quite as dangerous or violent, at least compared to boxing, as it originally seemed. With repetitive head strike, you can have not just concussion, but you develop chronic traumatic encephalopathy, or it's chronic traumatic brain injuries. And then people in the long term are developing all of these neurodegenerative changes, predisposing them to Parkinson's, Alzheimer's, early memory changes, and even premature death. And we started studying this, of course, with the football players in the NFL, but it's really been something that we've studied now across all athletes. You really can't diagnose this any other way than by an autopsy. So we're getting better and better at appreciating that it's there. We're definitely getting better at recognizing that if an athlete is injured, when we were growing up, it used to be like, get back out there. Like you kind of got your bell rung, like, kind of brush it off, suck it up and get back out there. Now, being a little bit more careful because that might not be an injury that someone can recover from. And certainly if someone's had 1 concussion, that 1 injury is bad enough, but if they get a second concussion quickly after that, it's a very serious injury. So it's more than just 2 concussions. It's 2 plus 1 plus 1 does not equal 2. 1 plus 1 equals 6 in terms of the severity of the injury. So what I asked you at the beginning is, these combat sports, would you let your kid do this? This is my family. We had the opportunity to study in Japan. And I think there's a lot of value to the martial arts. Again, we're not all in this for competition. We're doing it for fitness, for self-confidence, for self-defense. All of those things are good. And it can be done safely. And now there will be those freak accidents. I reported some devastating cervical spine injuries, fracture dislocations, and there could be traumatic brain injury. However, it can be done safely, particularly point sparring. And the conversation that most of us are having with our kids that are interested in sort of what we'd consider the more traditional sports like football, you can choose between tackle football and flag football. And 25 years ago, we didn't really have flag football. Now it's becoming more and more popular because you can still get those benefits of playing flag football and participating in that sport, but maybe not quite as dangerous in terms of the traumatic brain injuries. It's really, we can fix the other orthopedic things. If you fracture your femur, we can fix it and you can be okay, even though it's a serious injury. We can't fix the concussion or the traumatic brain injury. So the difference between full contact boxing, mixed martial arts, Muay Thai, versus point sparring, Kenpo Karate, my system. In 30 years, I haven't had any serious injuries, at least none that I can remember. I think that's an important difference and something that I would encourage my children to participate in. Thank you.